Hi, my name is Dr. Samir Mehta, and I'm a cardiologist in Miami in the United States. And this morning I decided to make a brief recording to help many friends and relatives back in New Delhi, India, which I still consider my hometown. I'm very concerned with the date and the release and the manner of the lockdown, and I think this has severe implications, particularly in the large metropolitan centers in India, including New Delhi, Mumbai, Chennai, and possibly even parts of Gujarat. Now, my analogy is simple. I think India is still in the middle of the crisis, at least for the next 2 weeks. And the analogy is that whether you get killed at the height of battle or coming home, you still are a casualty. So be safe. And I think releasing the lockdown after the coronavirus crisis, I think is possibly the hardest decision any politician has ever made. It has so many economic and healthcare implications, and from my heart, I believe nobody has gotten it right. Definitely not the United States, and not India also. I do believe that there are lessons which we can learn from Spain, because how they did the release of the lockdown was not based on where you worked or where you were going to visit, but based on your age group. So a practical benefit of that could be in India, where rather than just copy and paste and ape the lockdown release recommendations from the United States or elsewhere, you can be more intelligent. And here is my recommendation for the friends in India. Should you be over 60 or have medical conditions such as diabetes, I would request you to maintain a self-imposed isolation in your homes, a kind of a lockdown for the next at least 2 weeks. I also believe that the lockdown in India, and mainly in Delhi, has been wrong. It's been flawed for two major reasons. One, I think the healthcare situation is absolutely overwhelmed. Hospitals are absolutely filled to capacity. There are no specified designated areas for COVID patients. Physicians are exhausted. Resources are lacking. So in the middle of this healthcare peaking of the crisis, and it's overwhelming to release the lockdown, I think is wrong. And second, I think there is a little political misadventure happening between the Aam Aadmi Party and the BJP, which may have clouded a more sane decision. So I think the decision is probably incorrect, but here are my 4 recommendations for citizens of New Delhi, possibly for other places in India, and here they are. Number 1, I think you should limit your activities only to the essential ones when you're going outside the house. Otherwise, I think for the next 2 weeks, you are still better off maintaining yourself in your homes, and particularly if you happen to be of the elderly or having any medical conditions. Secondly, I think this is something which is such an important part of India, the household help which is coming. I think, should it be possible, these people, whether it be your person who comes to clean, to cook, a driver, a gardener, I think they should still be kept off your premises for the next 2 weeks. But should you require them, at least insist that they have a face covering and possibly the use of gloves. My third recommendation is straightforward. No rocket science here. Be sure that whenever you're outside the house, have a face covering, a mask, gloves, and of course meticulous hand washing. My last recommendation, of course, is going to surprise you. It pertains to homeopathy, and a cardiologist in the United States making the statement, of course, should not, it will come to you as a big surprise. I could not truly advocate this here in the United States because of the wide and the broad skepticism, but in India I saw my father treat hundreds of thousands of patients with homeopathy. It is inexpensive, it is safe, You could use it with whatever else you are using. And here are my two very specific recommendations with homeopathy. Number one, for the general population, there is a remedy, it's known as a genus epidemicus, something which can be used by the population at large, and this is camphor in the dose of 1 m. Take maybe a dose every 2 weeks, 3 or 4 doses should be all you need. Camphor 1 m. The second is for if you're having symptoms, if you're having body aches, myalgia, fever, some cough, little difficulty in breathing, you have a feeling you may have caught the virus, you may not be able to get to a doctor, may not even get a homeopath to see you. So my recommendation there would be, if you have symptoms, arsenic, I made a mistake there. Arsenic is also one of the recommended medications, but specifically for this condition, it should be Bryonia alba, dose 30. Once again, Bryonia alba in a dose of 30, and you could take 3 to 4 doses each day for about 2 to 3 days. So that would be my recommendation. Once again, for the general population, camphor 1 m, and if you're symptomatic, Bryonia alba 30. I hope this recording is useful for you. Stay safe, and this too shall pass.